Okay, so today we're going to talk about lumbar instability. That's essentially where the lumbar vertebra is unstable and you have hypermobile joints. So if you look in here, these joints are not aligned, and when it's not aligned, it's going to push into the spinal cord and it's going to cause some discomfort and pain. And stiff doesn't mean stable. So we have two types of lumbar instability. We have structural and functional. Structural you can diagnose based on a radiograph image, and you can look at the radiograph and tell whether there's a shift of one vertebra that's forward or backwards in a side view of a radiograph. And for functional, it's kind of hard to distinguish, but essentially it's loss of ability to maintain a typical pattern of displacement or movement under a load. And some precautions for that are some avoiding high impact activities, or any contact activities, avoiding activities that cause pain if possible. I understand that if it's part of your job you're going to have to do it, but try to avoid it if possible. And avoid strenuous activities, and also be aware of posture. And now we're going to talk about some home exercise programs that you can do to help treat lumbar instability. Alright, today we're going to show you some exercises for stabilizing your lumbar spine, which essentially is increasing your abdominal strength. And today we have Nick here as our patient. He's a 50-year-old office worker who sits a lot in his chair a lot at work. And we're going to teach him how to do these exercises. We have a home exercise program right here that we're going to go over with him. And we're going to start off with some dead bugs. So dead bugs, you're going to lift your feet and knees up off the table. You're going to try to keep it at 90 degrees. Keep your arms straight up. Pull your belly button towards your spine. Really contract those abdominals. You can push down on the abdominals to try to feel a contraction. And you're going to hold this for 30 seconds. Sound good? Mm-hmm. All right, you can relax. So that's this one right here. There's a picture for you too. So you're going to do that twice, 30 seconds hold for each of them. And then next we're going to do a bridge with a 3-second hold. So you're going to keep your feet about shoulder width apart. Squeeze that stomach, pull that belly button in, squeeze your butt, and lift your hips up. Hold it for 3 seconds, and then lower it down. Good. And you're going to do that 10 times. You're going to do 2 sets of those. And that's this exercise here. All right, and then next we're going to move on to the supine march. So you're going to keep your knees bent. You're going to squeeze the abdominals again, and you're going to bring one knee up towards your chest. Good, and back down. Make sure your hips don't come off the table. Bring your knee up, and then back down. Does that feel okay? Mm-hmm. All right, so you're going to do 2 sets of 10 of those two, which is right here. And then we're going to do some stretching. You're going to stay in this position. You're going to bring one knee towards your chest. Keep this leg straight. Bring it towards your chest. Hold. This one's going to stretch out your lower back. Do you feel that stretch? You're going to hold this side for 30 seconds, switch sides, and do it this side for 30 seconds as well. And that's this one right here. Okay, and next we're going to have you flip over onto your stomach. And keep your arms by your side. Push yourself up, push your chest off the table, but also try to maintain the hips on the table. So relax your foot. There you go. And this one you're going to stretch out those abdominals that we just worked. Does that feel good? All right, we're going to do 2 sets of 30 seconds for those at home, and that's right here too. Picture. Okay, next we're going to talk about posture a little bit, so I'm going to have you sit on the side of the table. And so some tips about posture. We know that as your muscles fatigue, they're going to start to lose posture, you're going to have bad form, and you're going to cause a lot of pain. So we're going to ask you to set a reminder on your clock, your cell phone clock or something, every hour or so, and try to reset your posture. Something that's really important is to bring your shoulders back, keep your shoulders down, keep your head up tall, and also keep your hands on your hip like this, and try to tilt your hip forward. Bring the front side right here forward. Good. So I want you to do that every hour. Set the alarm, and while you're at work, or even when you're at home watching TV, set it. So make sure you don't lose that posture, because it's just going to get worse if you don't fix it. And then lastly, we're going to do a little bit of sit to stands. So you're going to keep your feet shoulder width apart. You're going to lean forward a little bit, squeeze the butt, and push off the heels. Good. And come back down. Try to keep that chest up. Perfect. Good. So really want to push off of this heel right here, okay?
And you're going to do that 15 times to try to increase your muscular endurance. We want you to be able to do this. I'm sure you like get up and out of your chairs like a lot during work, right? So we want you to be able to do this without getting fatigued, because if you get tired, your forearm's going to start going out the window, and we're going to get that pain back. So that's what we're trying to fix. Good form, make sure that pain goes out the window. And here's the list of all those exercises we just went over. It's for you to take home. I want you to do these twice a day, once in the morning, once at night, and the posture, really focus every hour if you can. And that's all we have.